Hello and welcome again to another interesting episode in our interview series on Dental TV. It's a great pleasure and honor to have Diego Gabathuler with me. We had already, I think, 2 interviews together at the IDS 2023 when you still were working with Ivoclar. And now it's interesting because you switched not the total business, you're still in dentistry, but leaving Ivoclar as a company with filling materials, restorative materials, etc., switching to Geistlich. What is Geistlich? Maybe, Diego, you explain us first what Geistlich is all about. It's also a Swiss-based company, as far as I know, and even longer on the market. We have Vita and Ivoclar that celebrated 100 years. All other dental companies are around 100 years old. And Geistlich, I think, you told me, 175 years old. But let's start. Who is Diego? Because not everybody knows you. And why are you now working with Geistlich?
Yeah, first of all, thanks for the invite. Great pleasure to be with you again. I always enjoy the interviews with you because you're smart, you have a good sense of humor, and it's always fun. Working for Geistlich is the leader in regeneration, or in other words, biomaterials. We have invented regeneration of hard and soft tissue about 3 decades ago. And it started in dental, so regenerating bone and soft tissue. And then already a few decades ago, the company moved into other areas, regeneration of cartilage in the knee, regeneration of rotator cuff in the shoulder, and
I
other
think
areas.
you're mentioning that Geistlich, because for dentists, Geistlich is a dental company, but you already explained to me, let's say the major business is not even in dentistry, as far as I understand.
The major business is dentistry, but as I said, we moved into other areas of the body already many decades ago. So we are also leading in cartilage regeneration in Europe, rotator cuff, shoulder rotator cuff, spine, foot and ankle, and many other areas where we are also regenerating hard and soft tissue.
That's interesting because let's start with, I wrote down some questions that are interesting also for our audience out there. So we see a change in the dental landscape, switching from a man-only profession to a women-dominated profession. This is one topic, but market development and challenges. So we have new challenges, things are changing. What is going on in technology? What is the future of these regenerative materials? So far, I know Geistlich and these materials for many years. And for me personally, I was feeling, well, it remained the same. So what are the breakthrough things? What is happening in the development at Geistlich?
Most of the products today, they come from animal origin. So they are bovine or porcine materials that are then cleaned up and treated to be used in the human body. And I think that will remain unchanged for many years. But at the same time, we are also working now with synthetic materials and also mixed variations. But they are not on the market yet. But certainly we see opportunities that, more speaking about the long term, we even would consider that you get an individual customized regeneration material based on your DNA and on your individual health status. But that's a bit more on the very, very long term. On the short term, I think also we are working right now on integrating the regeneration part into the digital workflows that are already out there in the market.
Oh, that's interesting because prevention, maybe we do a little round tour talking about prevention. Prevention is a topic that these days is really popping up again. I remember when I was a student, Professor Müllermann told us, he was a pioneer in prevention in the 1950s, 60s. He started the dental, I would say, Schulzahn-Kliniks, or the dental clinics for the younger generation. He started sending out people to the kindergarten to show the children how to brush their teeth. And I remember when he was saying to us students, the goal, the vision of prevention is to eliminate or almost eliminate our profession. We will need few dentists to correct the teeth, let's say orthodontists. We need doctors or dentists to fix broken teeth or if anything happens. But the overall number of dentists and doctors should be reduced when prevention really works. But what I see is the opposite. We have more and more dentists, we have more and more doctors. So what is your idea, or is there a strategy behind Geistlich also talking about prevention? Or what is the context of biomaterials in prevention, or is there any context?
Yeah, that's a very interesting question and a highly relevant topic, I have to say. And Switzerland is a good market to look at. Switzerland is the first and only market where the number of implant treatments is going down worldwide. Because, as you said, in Switzerland was one of the countries, there's a few others in the Nordic areas, but Switzerland for sure was one of the first countries that really emphasized prevention, as you said, many decades ago. And the statement that you mentioned was very visionary at the time, I have to say, if we think back. And I also believe, I think prevention is the way to go. We need to prevent the problems where our business is based on. Because regenerative treatments, they're very expensive, they take a very long time, and they are also very disruptive for the body. So I think right now we are at a very interesting point in time where patients or people and consumers, but also professionals start to understand the mouth-body connection, how important good oral health is for good overall or good general health. And I think now we also have the technologies for education, for early detection, for correlation analysis. I think we are very close to a very big breakthrough when it comes to prevention.
But it's interesting. I did some research on that. And one of the biggest issues or problems blocking prevention being more, let's say, everyday business in dental offices or at doctors is the patient. Patients today still expect that something happens. When they come to the doctor, when they come to the dentist, they expect that a treatment happens. If you come to me with problems with your knee, I ask you, what did you do? Yeah, I did a 200-kilometer bicycle tour. Are you a regular bicycle rider? No, this was just for fun with my friends. And then I say, okay, look, that's normal. We can put some Voltaren on. You stay a little bit calm for the next 2 weeks and everything is gone. That's the cheap option, considering prevention. Say, I listen to you and I find an easy solution. The other thing is, because I'm hired in a private clinic, I earn a lot of money and I have to make money. So I say, yeah, Mr. Gabathuler, we have to take a closer look at that. At least we do an MRI or a CT, and considering your age, you're not 20 anymore, we should do a full body check to find out how healthy you really are to avoid these problems. What is the difference? One treatment is 80 Swiss francs and the other one is 10,000. But the patient prefers the 10,000 Swiss franc treatment. And that's also the thing that we should, let's say, educate or create awareness for our patients. And I see it also in my dental office. A patient feels, disappointed when you do nothing because you tell him you don't have a problem. So this is, and I don't know how companies like Geistlich or other dental companies can help us also to create the awareness to say it's not everything about intervention, invasiveness. It's sometimes avoiding a treatment, preventing a treatment that would be a better solution. Is Geistlich also a little bit in that? Because I know that basically you are cutting away part of your business. When you tell people you don't need me, you're cutting away business. So these are the things that I see. What would be your vision or an idea to attack this or tackle this problem?
Yeah, so that you raised a few very important topics: psychology, ethics, and business strategy. And let me go from reversed order. So on the business strategy, I think to eliminate our own existing business with better prevention is the best business strategy. As we discussed before already, I think disrupting company need to disrupt itself constantly and constantly evolve. The second part is, I think for the next few years, there will be a lot of dentistry to be made because of bad treatments from the 80s and 90s and from 10 years ago. So we really speak long term, like 20, 30, 40 years. So nobody needs to be afraid that there is not enough work anymore in the next 10 or 20 years. And I think two of the biggest business drivers are pain and vanity. So either people want to have pain going away or they want to look good. And I think if we can also connect prevention also to a beautiful smile, not only good oral health and a beautiful smile, they go together. I think that creates even more business opportunities. And of course, in the end, it's education and communication. If you explain me as a patient that sometimes doing nothing is better and you explain it well, I think that's also valuable information I'm willing to pay money for.
Absolutely, that's the point. We have to get to the point where prevention pays off. There's another interesting example. You may have heard about transillumination. So we can use fiber optics to look through the teeth because teeth are transparent. So we can detect early caries. We can, let's say, prove what we have seen on an X-ray just by transilluminating teeth with LED lights. Very cheap, very easy. And why? This was invented in 1922, so 102 years ago. We learned that at dental school, but if you ask people or if I ask my colleagues during lectures, they don't do it. And I give you the answer why they are not doing it. You know why? There's no position for it. You don't get paid for it. That's why you're not doing it. And this is also a thing. If we have something that exists for more than 100 years, obviously is non-invasive, effective, cheap, quick, and efficient. Why are we not finding something that we can say, okay, we can charge five euros for it? And so the dentists that they say, this is a benefit for me and my patients, they do it and do it for free. And others say, I don't do it because it's not free, because I cannot charge for it. I remember I taught 50% of the dermatologists in Switzerland on photography. And this was 15 years ago, 15 years ago. And at that time, dermatologists did not take pictures of their patient. And you know why? Because they were not able to charge for it. So this is the issue. Prevention is also blocked. You could, as a doctor, say, look, I now have something innovative. I will take pictures of all the points, the discolorations you have on your skin to monitor the progression of the disease. And there's no position for it, but I will charge 50 Swiss francs for that. And I'm sure that 99% of patients would say, oh, that's great that you're so innovative and doing this, and I'm ready to pay for it. I'm 100% sure if you explain it correctly. But a lot of people are like hiding behind, oh, there's no position for it, so I'm not doing it.
I think what it requires is we as an industry, we also need to have a more intense dialogue with government and insurance companies, because I think that's the most effective and also best driver we can use to really take advantage of these. As you say, they're not new technologies. This could have been done already many years ago. But then we are back to the psychology argument again. If it doesn't hurt yet, there is no case for action. And let's say the percentage of people who really apply the preventative mindset, not only regarding oral health, but overall general health, there's a lot all of us can do for preventing many problems in our entire body. But it takes effort. First of all, I need to understand it. And then it takes effort. I really need to think, okay, doing exercise today or a healthy nutrition will help me in 20 years from now. That requires a lot of good and trustworthy communication in the right communication channel. But as with many things, it will take time. But I truly, again, I would like to state this again. I believe we are very close to a disruptive breakthrough when it comes to prevention, not only in oral health, but also in general health.
I hope so, because this would, for me, sure dramatically reduce the cost. But for example, the big market of obesity, now Ozempic and all these medications are popping up, and then our son working for Roche told me, look, obesity is still on the rise, and it will go up until 2035. So, and for the next 10 years, although everybody knows that you should drink so much, like Mexico with the highest rate because they live from Coca-Cola, and they take so much sugar that they get bigger and fatter and fatter. So the mindset, there's still a lot of work to do from the industry, from the governments to go this direction. But let's switch and talk about digitalization and innovation. So AI is the buzzword. It's interesting that some software tools that exists for 20 years, they were software 20 years ago, and now they are AI tools. So it's interesting that now everything is an AI tool. CAD/CAM software that has nothing to do with AI is now AI. In dentistry, AI tools for now are, as far as I see, very limited to diagnostics. So helping us to check X-rays. But then AI, what is the role of AI in development of new products or at Geistlich? I'm sure you're also thinking about how AI could improve your work.
Absolutely. But let maybe first a general statement about AI. I think technology is great, but it always also requires human intelligence. And there's a few examples. So if you use, probably all of us have used AI or not AI, a software for translation. The translation is very dry. It's a word-by-word translation. And the human intelligence can then bring emotion to the translation. And the same idea you can bring to a crown design. Of course, AI, we know that the acceptance rate is above 90% for AI crown design. But I still believe that a very skilled dental technician can do it better because there's the human creativity. Maybe for that patient with that shape and that face expression, maybe I design the tooth a little bit different and give it that little touch. So I think it's important always to connect technology with people. Of course, there are certain areas like these very simple repetitive tasks where AI can work completely autonomous of human intervention. And coming back to the question how we use it, so we use it for many different applications. We use it in research and development, so we can actually develop more parallel streams with less resources. So of course we can develop faster, we can research faster, but we are also using it in many other areas, like for content design, for social media, for translation, for internal documents. But I think we are at the very early stage. Last month, I was in Austin at the South by Southwest conference, and I talked to an AI expert, and he told me that the energy consumption of the AI today is too high to really use it in every area of our daily life. But also there, like in many other technologies, this will come. How fast? We don't know, but certainly it's very interesting, and it will also enhance our human capabilities.
Yeah, absolutely. Another topic that is really, let's say, everybody's talking about is sustainability, being responsible, being eco-friendly. How does Geistlich or this company, because basically you're replacing missing materials. So biomaterials are replacing lost tissue structures, mostly bone that is lost by periodontitis or other diseases in the body. But what is sustainability or recycling concepts and all this stuff? How are you working on this in the company? Because packaging, for example, is a huge topic. I see it when we open up the box of the implants. I think the most expensive part of the whole implant is not the implant itself, but it's the packaging. So sometimes, and what is your strategy in regard of this?
Of course, it's a very broad topic and it touches every single area of the business, from traveling, logistics, event management, packaging, and many more areas. Maybe just one of the recent projects that we have concluded is we have reduced the packaging significantly. And that brings the advantage. First of all, it's less material, but also improved the logistics cost, came down significantly, so we can move more boxes on one pallet wherever they need to go. But there is hundreds of sustainability initiatives. We just implemented a photovoltaic in Wolhusen in our R&D and manufacturing facility. But already there for hundreds of years, we have used water power to generate energy. So also there we have been pioneers in terms of sustainability.
No, because the problem, there's like concept, the green practice or whatever. The problem is that the regulations that the medical business, not only dentistry, the medical business makes us less and less eco-friendly because we have to single-use materials, we have to throw away. I even heard that at some clinics, for example, in Basel or Zurich at the university clinic, they prefer to throw away material because it's more expensive to regenerate the instruments than throwing them away and buying new ones. So there's a huge potential also of being more eco-friendly in our business when regulations would be a little bit less strict. So what are your thoughts on this?
Yeah, I hope that we can also apply the concept of self-responsibility. Even if something is maybe a little cheaper for me to throw away, I have a responsibility to really consider, is this the best thing for humanity as a whole? But I agree with you. In the end, of course, regulation is important. But there, I believe, again, as in the example mentioned beforehand, it just requires a very good dialogue between the governments and the industry.
Let's to get to the last question. So the dental community. So the dental community is changing. So how are you attacking the change towards more social media presentation? A lot of dentists are struggling actually to present themselves, even having a good website or presenting themselves on social media. I know that for companies, it's also not so easy. And again, the example of our son at Roche, I was telling him, why are you not more active on social media? And say, we are not allowed. Pharma company is not allowed to get directly in touch with the customers, basically, because their customers are the doctors and they are then getting in touch with the patient, so they cannot get in touch directly with the patients. So how is the dental industry working in this context of communication? Because we talked about it's important also for the dental industry to get in touch with the patients, to inform them that they talk also to the dentist, maybe about prevention, about innovations, etc. What is your strategy in this, let's say, broad concept of communication? Because I see there's a huge lack of communication skills in dentistry, not only in dentistry, but dentistry especially. I saw that over the last years when I was more into social media with my dental TV project and so on, that the majority of dentists struggle to communicate with each other and also with their patients. So what can you give us or help us in this context?
Yeah, so there's quite a few things we do. You mentioned patient communication. So there we provide great tools, analog and digital, that helps the dental professional to communicate to the patient what regeneration really means and what are the different options for the patient. And this we want to elevate. So this is, I have to say, most developed in China. Actually, the Chinese dental community is taking advantage most of this patient communication, but it's also available in other markets. And this is an area we want to intensify. But it is patient communication through the dental professional. So that's number one. Second is, I think, connecting within the industry opens up new opportunities. So just at IDS, we had a meeting where different companies from different areas connected and said, okay, how can we in the future provide platforms for the dental community to actually bring education and communication forward? And already today, we support many platforms. We have our own platforms. Then, of course, we financially support also platforms from associations. And we also work with other companies together to bring the dental community together for a good exchange.
So you could also sponsor or support dental TV? So we have to talk about that.
Let's talk about that.
We have to talk about that because the idea of dental TV is really to provide the dental community with free information.
Mm-hmm.
In the beginning, I thought, okay, I do it subscription based, but now I decided, no, I really want to share as much information as possible. So for me, it's like time to giving back and share my knowledge. A lot of things that you never never taught at dental school. So this is my mission. Maybe we can talk about that, how we can use also some of your resources to promote projects like Dental TV. But that was an interesting insight in what's going on in the dental industry. Again, Diego Gabathuler, thank you very much for an interesting conversation.
Always
It was
a great pleasure.
Pleasure is on my side. So stay tuned for more interviews like that. We have over 100 interviews already available on Dental TV, not only with Diego, but with many people around the globe. And it's always interesting to hear different ideas, different concepts, and these ideas should inspire you to be a little bit more proactive and not hide yourself into your small dental office. Open up your ears, open up your eyes, not only because of artificial intelligence, but human intelligence still matters. So stay tuned and see you again soon on Dental TV.
Goodbye.
Perfekt. Sehr gut.